Hi, my name is Radie and I am a student at Washburn University in the Occupational Therapy Assistant Program, and today I will be talking about oppositional defiant disorder. Oppositional defiant disorder, or ODD, is a type of behavior disorder. Children are normally classified as uncooperative, defiant, and hostile towards peers, parents, and other authority figures. ODD is diagnosed in childhood. Signs usually begin during preschool, but can develop later, usually before adolescence. It is sometimes difficult to recognize the difference between a strong-willed and emotional child and a child with oppositional defiant disorder. It is normal to exhibit oppositional behaviors at a certain stage of a child's development. With ODD, there are significant impairments in family, social activities, school, and work. What causes ODD in a child? Researchers do not know the exact cause of ODD, but there are two theories to why this can occur. One is the developmental theory, suggesting that the problem starts when children are toddlers. Children and teens have problems learning to become independent from parents or others who they are emotionally attached to. Developmental issues may persist beyond toddler years. The other is learning theory, suggesting that the negative symptoms of ODD are learned attitudes. The use of negative reinforcement increases the child's ODD behaviors. These behaviors allow children to receive either attention or reaction. Genetics and environment may also be a contributing factor. Genetics can give a child a natural disposition or temperament. Environment, because problems with parenting may involve lack of supervision, inconsistency, or harsh discipline, abuse, or neglect. ODD is more common in boys than in girls. Children are at more risk of ODD if they already have mood or anxiety disorders, depression, conduct disorders, or ADHD. About 40% of children with ADHD have ODD as well. There are also a high number of patients with conduct disorder who have ODD as well. This leads to more behavioral problems and other mood disorders. They are also at a higher risk for substance use and abuse. ODD can lead to problems such as poor school and work performance, antisocial behaviors, impulse control problems, substance use, and suicide. Most of the symptoms of ODD are seen in other children around the ages of 2 or 3 and during adolescence. But the difference is that children and adolescents with ODD, these symptoms occur more often. The DSM-5 criteria includes emotional and behavioral symptoms that last at least 6 months. These symptoms include angry and irritable moods, which includes losing temper easily and often, frequently touching and easily annoyed by others, often angry and resentful. They are also argumentative and have defiant behaviors. This includes often arguing with adults or others in authority, often actively defying or refusing to comply with adults' requests or rules, often deliberately annoying or upsetting people, and often blaming others for mistakes or behaviors. They also have signs of vindictiveness. ODD may vary in severity. Mild symptoms occur only in one setting, such as home, school, work, or with peers. Moderate symptoms occur in at least 2 settings. Severe symptoms occur in 3 or more settings. Treatment for ODD can depend on symptoms, age, health, and as well as severity of ODD. Treatment for ODD may include cognitive behavioral therapy, family therapy, peer group therapy, and medication. Early intervention programs, school-based programs, and parent management training are also helpful when treating ODD. As an occupational therapist, when evaluating a child with ODD, it is important to zero in on the activities that the child has trouble with due to their adverse behaviors. With this, the OT practitioner can paint a picture of a holistic approach to the parents and find ways to decelerate these behaviors. We can also provide social skills training to help with making and keeping friends, as well as helping with reciprocating healthy conversation and how to react in certain situations. We can also work on problem-solving techniques, which will help reduce negative behaviors. With reducing these behaviors, children with ODD will be able to participate in daily tasks more successfully. Because of the challenging relationships between children with ODD and parents. OT practitioners can use interventions that involve positive communication between the parent and child. Sensory processing can help reduce the sensory overload and help the nervous system regulate sensory input. Some general principles we can use to treat clients with ODD that are having sensory processing issues is adapting to sensory expectations. We can do this by teaching self-modulating techniques. These can be helpful no matter the child's sensory state. These techniques include deep pressure and heavy work. Depending on if the child is hypersensitive or hyposensitive, you want to either increase or decrease sensory input. Doing this will help the nervous system find a sense of balance or harmony. Some other things we can do as occupational therapy practitioners is work on transitioning from one activity to another, as well as promoting exercise to promote healthy brain function and help control aggression. Thank you for listening to my presentation on oppositional defiant disorder.